Imagine this. You're 70 years old and you're alone at home, maybe reading a book or watching TV, when suddenly a crushing pressure hits your chest. Your left arm goes numb, you struggle to breathe, and panic sets in. You're having a heart attack, and no one is around to help. Right now, at this very moment, someone's grandfather, someone's mother, is experiencing exactly this nightmare. Every 40 seconds in America, someone has a heart attack. And here's the shocking truth that doctors don't talk about enough. 380,000 seniors experience heart attacks while completely alone every single year. But here's what will absolutely shock you. A groundbreaking European Heart Journal study tracked 2,400 seniors and discovered something extraordinary. Those who knew one specific 60-second technique increased their survival chances by 73%. That's right, knowing what to do in just 1 minute can literally decide whether you live or die. But here's the terrifying part. 89% of people over 60 have no idea what to do when they're alone during a heart attack. They freeze, they panic, or they do things that actually decrease their survival. Right now, before we go any further, I need you to do something. Look at the subscribe button below this video. Can you see it? Click it right now. Why? Because in the next 15 minutes, I'm sharing 7 scientifically proven techniques that could save your life or the life of someone you love. This isn't theory. This is evidence-based research from Johns Hopkins, Mayo Clinic, and Harvard Medical School. And if you miss even one of these tips, you might not get a second chance. Also, drop a comment right now telling us your age and where you're watching from. Here's something that'll blow your mind. The number 1 technique. I'm revealing at the end. Researchers at Harvard Medical School discovered it gives you the same survival advantage as having a paramedic standing right next to you in your living room. Emergency dispatchers are now being trained to coach people through this technique over the phone, and it has absolutely nothing to do with aspirin or calling 911. Ready? Your life might depend on the next 15 minutes. Let's begin. Technique number 7. Emergency communication system. Let's start with something that seems obvious, but is absolutely critical when every second counts. And I promise, what I'm about to tell you goes way beyond just keep your phone nearby. Here's what most people don't understand. When a heart attack starts, your brain loses oxygen immediately. Within 15 to 30 seconds, you might experience confusion, disorientation, or temporary paralysis. A Journal of Emergency Medicine study tracked 500 heart attack survivors over 60. And get this, 67% couldn't remember their own address when calling 911. Think about that. 2 out of 3 people forgot where they lived, not because they had dementia, but because oxygen deprivation affects your brain instantly. Here's exactly what you need to do today, not tomorrow, not next week, today. Action number 1. Grab a bright orange or yellow index card right now. Write your complete address, including apartment number, on it in big letters. Add your phone number and any gate codes. Tape this card directly next to every phone in your house. When you're confused and panicking, this card becomes your lifeline. Action number 2. Program 911 as speed dial number 1 on every phone you own. Yes, I know you can dial 911 directly, but when your hands are shaking and you're losing coordination, hitting one button is infinitely easier than pressing 3 different numbers. Here's something that will shock you. The American Heart Association found that 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m. Want to know why that's so deadly? Because that's when most people leave their phones in another room charging. Action number 3. Keep your cell phone charged and within arm's reach 24/7, especially at night. Get a charging cable long enough to reach your nightstand. This one simple change could save your life. Quick question, do you own a medical alert device? If yes, type "have one" in the comments. If no, type "need one." Let's see what percentage of viewers are protected. Action number 4. If you live alone, get a medical alert device. But here's the key that most people miss. Wear it constantly, even in the shower. Research from the National Institute on Aging shows that 31% of seniors who own these devices aren't wearing them when they have their cardiac event. Why? They took it off for bathing or sleeping. Spend the extra $20 for a waterproof one. Your life is worth more than $20. Action number 5. Tell your neighbors about any heart condition you have. Give a trusted neighbor a spare key. Let them know to check on you if they hear unusual noises or if you don't follow your normal routine. These people can provide access for paramedics, potentially saving 5 to 10 precious minutes. In apartment buildings, inform the building manager or doorman today. Now, let's move to something controversial, but potentially life-saving. Technique 6. Cough CPR. This next technique is controversial. Some doctors love it. Others say it's misunderstood. But recent research has provided crystal clear guidelines on exactly when and how it can save your life. It's called cough CPR. And here's why it's so powerful. It works by creating pressure changes in your chest that help maintain blood flow to your brain when your heart rhythm becomes dangerously irregular. Peking Union Medical College followed 240 patients who were taught cough CPR. Those who used it correctly during early stages of a heart attack maintained consciousness for an average of 92 seconds longer than those who didn't. You might be thinking, only 92 seconds? That's nothing. But here's the reality. 92 seconds is enough time to call 911. It's enough time to unlock your door. It's enough time to take your medication. When your brain is dying from oxygen deprivation, 92 seconds is an eternity. Here's exactly how to perform cough CPR correctly. And please, practice this right now while watching. Step 1. At the very first sign of heart attack symptoms, before you lose consciousness, take the deepest breath possible. Fill your lungs completely. Imagine you're trying to inflate a balloon in your belly. Step 2. Cough hard and deep, like you're trying to cough up something from deep in your chest. This isn't a throat cough. It comes from your diaphragm, from way down low. Step 3. Repeat this cycle every 2 seconds without stopping. Deep breath in, hard cough out. Deep breath in, hard cough out. What's happening inside your body is fascinating. Each deep breath brings oxygen into your lungs. Each forceful cough squeezes your heart and keeps blood circulating. You're essentially manually pumping your heart when it's not doing its job properly, however. And this is extremely important. Cough CPR only works if you're still conscious and only in specific types of heart rhythm problems. It won't help and could actually be harmful if you're having a complete heart attack with totally blocked arteries. That's why you should only use it while you're waiting for emergency help to arrive, never as a substitute for calling 911. The Cleveland Clinic emphasizes this technique is most effective in the first 30 to 60 seconds of symptoms. That's why knowing it ahead of time is so critical. You won't have time to Google it when you need it. If you haven't already, please hit that like button right now. It takes 1 second and helps YouTube show this life-saving information to more seniors who desperately need it. Now, here's something about aspirin that might surprise you. Everyone knows to take aspirin during a heart attack, but 91% of people are doing it wrong. Technique number 5, the aspirin protocol. Everyone and their grandmother knows about taking aspirin during a heart attack. But what most people don't know is there's a specific way to take it that makes it work up to 50% faster. And that speed difference can determine whether you live or die. First, let's understand what aspirin actually does. When you have a heart attack, it's usually because a blood clot has formed in one of your coronary arteries, blocking blood flow to your heart muscle. Aspirin works by making your blood less sticky, preventing the clot from getting bigger, and potentially helping blood squeeze past the blockage. A massive study in The Lancet, involving 17,000 heart attack patients, found that taking aspirin within the first hour reduced death rates by 23%. But here's the game-changing part that most people get wrong. You need to chew the aspirin, not swallow it whole. Let me say that again, because it's so important. Chew the aspirin. Don't swallow it. Why? Chewing breaks down the tablet's coating and increases the surface area, allowing it to be absorbed through the lining of your mouth, rather than waiting for it to dissolve in your stomach. Research from the University of California, San Diego showed that chewed aspirin reached therapeutic blood levels in an average of 14 minutes, compared to 26 minutes for swallowed tablets. Think about that. 12 minutes faster. When your heart muscle is dying from lack of oxygen, those 12 minutes could mean the difference between full recovery and permanent heart damage. Here's the exact protocol. Dose: 325 milligrams. That's typically 1 regular strength tablet or 4 baby aspirins. Method: chew it thoroughly, even if you have coated or enteric aspirin. Yes, it will taste absolutely terrible, but that awful taste is worth the increased speed of absorption. Storage: Keep non-coated aspirin in multiple locations: your bedroom nightstand, your kitchen, your living room, your car, your purse or wallet. Maintenance: check expiration dates every 6 months and replace as needed. Store them in their original bottles to protect them from moisture. Here's something crucial many people don't realize. If you're already taking daily aspirin for heart disease prevention, you should still take an additional dose during a suspected heart attack. The preventive dose is usually only 81 millimolar, which isn't enough during an acute event. Don't take aspirin if you're allergic to it, or if you're taking blood thinners like warfarin. Talk to your doctor now about emergency protocols if you're on blood thinners. Quick poll: type check in the comments if you're going to check your aspirin supply right after this video. Let's see how many of you take action. Now, let's talk about a body position that could keep you alive long enough for help to arrive. This next tip is something most people get dangerously wrong. Techniques. Number 4 and number 3. Position and breathing. Your body position during a heart attack can significantly affect blood flow to your heart and brain, potentially buying you precious time. The European Resuscitation Council found that proper positioning can maintain blood pressure and consciousness up to 40% longer. Here's what you need to know. If you're experiencing heart attack symptoms, don't lie flat on your back unless you're about to lose consciousness. This position can actually reduce blood return to your heart and make symptoms worse. Instead, sit up at about a 45-degree angle. You can achieve this by propping yourself against a wall or using pillows on a bed or couch. Your knees should be bent, with your feet flat on the floor or bed. This position, called the semi-Fowler's position, helps in 3 critical ways. 1. Reduces the workload on your heart by using gravity. 2. Makes breathing easier by allowing your diaphragm to expand. Helps prevent fluid from backing up into your lungs. Tokyo Medical University found that heart attack patients who maintained this position had 35% better oxygen saturation levels compared to those standing or lying flat. If you start feeling dizzy or like you're going to faint, lower yourself to the ground. Carefully, don't just drop. Once on the ground, lie on your right side with your left knee bent for stability. This recovery position keeps your airway open if you lose consciousness. Immediately loosen any tight clothing. Undo your belt, unbutton your collar, remove any tie or scarf. The Journal of Cardiac Nursing found that loosening a belt can improve blood oxygen levels by up to 8% during cardiac distress. Now for something that seems counterintuitive, but is scientifically proven to reduce heart damage by 45%. When you're having a heart attack, your natural instinct is to hyperventilate, taking rapid, shallow breaths. This panic response actually makes everything worse by reducing oxygen that reaches your heart and brain. The technique is called paced diaphragmatic breathing. Practice it with me right now. Step 1. Breathe in slowly through your nose for 4 counts. 1, 2, 3, 4. Step 2. Hold that breath for 4 counts. 1, 2, 3, 4. Step 3. Exhale slowly through pursed lips for 6 counts. 1, 2, 3, 4, 5, 6. The longer exhale is crucial. It activates your parasympathetic nervous system, which slows your heart rate and reduces oxygen demand. Put one hand on your chest, one on your belly. The hand on your belly should move more than the hand on your chest. If you're doing it right, you'll feel your stomach expand, not your chest. The American Journal of Cardiology reported that patients who practice this breathing for just 5 minutes a day could successfully use it during cardiac events 78% of the time. If you don't practice, your success rate drops to only 12%. We're getting to the top 2 tips now, and trust me, you don't want to miss what's coming. Tip number 1 has the same effect as having a paramedic in your living room. Technique number 2, door unlock protocol. This life-saving tip addresses a terrifying reality that kills thousands of seniors every year. Paramedics arrive at your home, but can't get inside. Let that sink in for a moment. Help arrives. The ambulance is outside your door, but you're dying on the floor, and they can't reach you because your door is locked. A Journal of Emergency Medical Services study tracked 8,500 cardiac emergencies. Locked doors delayed treatment by an average of 11 minutes. And here's the devastating part. 34% of cardiac deaths in seniors occurred because help couldn't reach them in time. 11 minutes. That's how long it takes for paramedics to decide they need to call the fire department to break down your door. By then, it's often too late. Here's exactly how to prevent becoming part of this statistic. The moment you feel heart attack symptoms starting, before you call 911, before you take aspirin, before anything else, walk to your front door and unlock it. If possible, leave it slightly ajar. The University of Pennsylvania found that patients who unlocked their doors as their very first action had 47% better survival rates than those who waited until after calling 911. Why does this work so dramatically? Because the average person loses the ability to walk within 3 to 5 minutes of a major heart attack starting. Once you're on the ground, you're not getting back up. For today, mount a key lockbox outside your home and give the combination to your local fire department. Call them today on their non-emergency line and register it. The National Association of Emergency Medical Technicians reports that registered lockboxes reduce entry time by 8 minutes. During an emergency, turn on every light in your house if you're able. Paramedics report that a house with all lights blazing stands out immediately. This saves 2 to 3 minutes of searching for the right address for apartment dwellers. Call 911 first. Then, immediately call your building's front desk or security. These people can meet the ambulance and guide them to your exact apartment. Urban Emergency Medicine found this reduced response times in high-rise buildings by 6 minutes. Keep a whistle attached to your keychain and in your nightstand. Even if you can't speak, making noise helps first responders find you quickly. Create an emergency information sheet and tape it to the inside of your front door at eye level. Your name, current medications, allergies, medical conditions. The American College of Emergency Physicians found that visible medical information reduced treatment delays by 26%. Smart locks are even better if you can afford them. These can be programmed to unlock automatically when 911 is called from your phone. The Cleveland Clinic found that patients with smart locks had 31% faster treatment times. Now, are you ready for the number one most important tip? This is the technique that Harvard researchers say gives you the same survival advantage as having a paramedic right there with you. Stay with me. Technique number 1, nitroglycerin protocol. Here's what that Harvard Medical School study discovered that amazed even experienced cardiologists. Patients who used nitroglycerin correctly within the first 3 minutes of heart attack symptoms had survival rates nearly identical to those who had immediate paramedic intervention. Read that again. Using one medication correctly gave you the same chance of survival as having an ambulance crew standing next to you. The key word is correctly, because most people who have nitroglycerin don't use it properly during an emergency. Nitroglycerin works by rapidly dilating your blood vessels, reducing the workload on your heart, and improving blood flow through partially blocked arteries. It can literally stop a heart attack in progress if the blockage isn't complete. A massive British medical journal study involving 12,000 patients showed that early nitroglycerin use reduced mortality by 35%, reduced heart muscle damage by up to 50%. If you have any cardiac risk factors, which includes being over 60, having high blood pressure, diabetes, high cholesterol, or family history of heart disease, you should talk to your doctor about getting a prescription for emergency nitroglycerin. Here's the protocol that could save your life. Step 1. At the very first sign of heart attack symptoms, sit down immediately. Never take nitroglycerin standing up. It can drop your blood pressure so quickly you'll faint. Step 2. Place one tablet under your tongue, not on top of it. The medication absorbs through the blood vessels under your tongue. Don't swallow it. Let it dissolve completely. 20-30 seconds. You'll feel a tingling or burning sensation. That means it's working. Step 3. Set a timer for 5 minutes. If symptoms haven't improved significantly, take a second tablet. Step 4. Set another 5-minute timer. If symptoms persist, take a third tablet and call 911 if you haven't already. Never take more than 3 tablets in 15 minutes. Nitroglycerin loses potency quickly. Keep it in its original amber glass bottle. Never transfer it to another container. Replace every 6 months, even if unused. Keep bottles in multiple locations. Don't store in bathroom or car. Heat, humidity degrades it. Write the date you opened it on the label. Fresh nitroglycerin should cause a slight headache or tingling. If it doesn't, it's no longer effective. If you take erectile dysfunction medications, Viagra, Cialis, Levitra, you cannot take nitroglycerin within 24 to 48 hours. The combination can cause a fatal blood pressure drop. Chew aspirin first, then take nitroglycerin. Johns Hopkins reported that patients who used both medications had 58% better survival rates than those who used just one or the other. These 7 techniques could literally be the difference between life and death if you ever face a heart attack alone. But knowledge alone isn't enough. You need to prepare. Action items for today. 1. Check your aspirin and nitroglycerin supplies. Set up your emergency communication system. Practice the breathing technique for 5 minutes. 4. Tell someone you love about these techniques. Have you or someone you love experienced a heart emergency while alone? What was the one thing you wished you had known? Share your story in the comments below. It might save someone else's life. And if this video provided value, please share it with every senior you know. Heart disease kills more people over 60 than any other condition, but knowledge and preparation can dramatically improve survival odds. Thanks for watching, and remember, the best time to prepare is before you need it. Stay safe, stay informed, and we'll see you in the next video.